Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all the participants of the webinar today. We are very sorry, please accept our apology that we have having problem with the speaker and the connection here. So I guess we can start from now on. So the honorable lecturers from all over places, from the University of Amikom Purwokerto, and also I can see some participants from State Islamic Institute of Purwokerto here, and also from Stiami Institute, and also from IAIN Jember. So thank you for joining with us for today's webinar. Okay, I can see also some students from the University of Amikom Purwokerto, so welcome. Ladies and gentlemen, I'm Ade Tuti Turistiati as the moderator for the seminar today. I'm very pleased to welcome all of you here to the webinar. So the seminar is jointly hosted by two universities, the University of Amikom Purwokerto and also Huachiew Chalermprakiet University, Bangkok, Thailand. And it is entitled Strategic Communications During COVID-19 Pandemic, Learning from Thailand. Some of you maybe want to ask like, why is it Thailand? Why we have to learn from Thailand? Okay, as we know that from the data from the World Health Organization and also some data from newspaper or online news, that Thailand since April and May, they have like a fewer cases of COVID-19, or even they have like a declining from May, and then they have already facing the new normal. So for that reasons, we would like to learn from our prominent speaker, Dr. Jonathan Rante Carreon. So he is the Assistant President of International Relations from Huachiew Chalermprakiet University. So before we start our session today, I would like to share with you about the program for today. So we have like welcoming remarks from our rector, Dr. MIkom. And then I have to tell you about the rules of this program. And the third, we have a presentations, and later on we have the question and answer from the audience. So if you have a chat, so please, while we have a presentation, you can write the questions, and I will be going to read your questions. And after that, we have a discussion and closing. All right. So let's start our program to have, is Dr. Berlana is already joining with us? Can you mute?
Okay.
Okay, Pak Berli, I would like to invite you to have like welcoming remarks now. So if you could say something to us. Yes, please, Dr. Berli.
Baik, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Ladies and gentlemen, all the participants of this international webinar, we are delighted and honored to jointly host the seminar Strategic and Communication during COVID-19 pandemic, learning from Thailand. The webinar today is a part to the implementation MOU between Amikom University Purwokerto and Huachiew Chalermprakiet University, Thailand. We are very grateful to Dr. Jonathan is available to be the speaker, the webinar. I hope our webinar will be useful for the participant. Dan semoga mudah-mudahan seminar ini bisa menjadi pelajaran buat kita semua. Again, thank you very much, Dr. Jonathan, and all participants. I hope you enjoy that webinar internasional ini, sehingga ini menjadi sebuah masukan bagi kita semua, belajar dari Thailand, sehingga mudah-mudahan kegiatan ini bisa bermanfaat bagi kita semua. Billahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Pak Belly, for welcoming your remarks. So now, can you show the screens about the rules? Okay. So, okay, for today's seminar, as I said earlier, that if you have any questions, so please write in the chat room, and then later on, I'm going to read the questions. So this is a very important thing, of course, for all of us. If we have a certificate from these seminars, you can download this link for a certificate. So you will have the form that to be filled, your name, your complete name that you want to write in your certificate later on, and also there is an evaluation form that you have to be filled in. All right. So now we are going to have a presentation from Dr. Jonathan Dante. But before that, I would like to little bit introduce who he is. So Dr. Jonathan Rante Carreon at the moment is international assistant president of international relations from Chalermprakiet University, Huachiew Chalermprakiet University, Thailand. He used to be the associate dean of liberal arts. And regarding his education, Dr. Jonathan, of course, he is a lifelong learner. He has like a 2 PhD degree from Macquarie University in linguistics and also applied linguistics from Thailand. He also holds 2 master degree in English and also English and what else? Okay, in public health. In public health. Okay, that's important for him to share about the things in Thailand. And also he also 2 bachelor degree in education and medical technology as well. So without further ado, I would like to invite Dr. Jonathan Rante to have a presentation. And after that, we are going to have the question and answer. Yes, please help me welcome Dr. Jonathan Rante Carreon for his speech today. Yes, please, Dr. Jonathan. Kedengeran nggak? Excuse me, Jonathan, I cannot hear you. Can you speak louder? Can you share your slide presentation?
Can you hear me now?
Yes, I can hear you. I can hear you. Oh, that's good. So can you share your slide presentation?
Okay, so I'm going to share my slide presentation. Please hold on. Seems like there's feedback. Can you still hear me?
Yes, yes, we can hear you.
Yes, we can hear you. Okay, so first and foremost, I'd like to thank the rector of and also to our participants from Indonesia as well as from the United States. STI West Negros University. I don't know if I'm clear.
Unmute. Jonathan, can you unmute your speaker, please?
Can you hear me now?
Yes, that's clear now. Okay. All right. Go ahead.
It's like there are two calls happening here, and also there is also, I think we can turn off the WhatsApp call. The WhatsApp call happening. There's calls now. So start now.
Sekarang
Both microphones are still on. Can I start?
Yes, please.
Okay. So good morning once again. Topic of my presentation is strategic communication during COVID-19 pandemic, and I'm going to share the experiences that we have here in Thailand. So let me just lower down the volume so that it will not affect. Okay, so here's my slide. I'm going to share with you the slide later, or you can get it from the Universitas Amikom Purwokerto because they already have the PDF version.
Yeah.
And let me just go to PDF. Okay. So from the very beginning of the pandemic, before the pandemic, or even before it was announced pandemic, there was already a call from everywhere, from all over the world. You're calling for us to stay home, and we have this very popular, what do you call this, kind of saying that encapsulates things that we are going to do. This coming from the healthcare workers, like, we stay at work for you, you stay at home for us, we're going to win. This is coming from one of the universities in Thailand, the MIT or Ilmu University. And coming from BBC, it says here, stay at home, stay apart, wash your hands. Okay, so just three things. Now, what I'm going to do in this short lecture is that I'm going to share with you the following. So we've got four. Number one is effective strategic crisis communication that has been done. So I'm going to focus on what is being shared, what is being disseminated within Thai government through its media, the media that are really available during this time for Thai government. And I'm going to talk about the main so-called information only. I'm not going to talk about other sources because we may not have enough time. And then I'm going to talk about COVID-19 communication, as I've said, what is being communicated. And then a little bit on at the very beginning, some theories on strategic communication or effective strategic communication, the mass media that is being used, and what innovations being introduced by the Thai government in order to contain the infection and in order to do some kind of massive contact tracing. So let's go a little bit, very, very briefly, on strategic communication. So effective strategic communication, we talk about strategic communication. I'm taking it from Reynolds and Briggs, 2008. they said that strategic communication in an open empathetic style of communication, not open, I'm sorry for that, is an open and empathetic style of communication that engenders public trust. So that is those are the keywords. Open means when you listen to people, then some people can share their information, can share the idea. It's empathetic, meaning to say they have to listen really, really carefully what's going on and what these people need. These are particularly their constituents. And then something that engenders public trust, which means that who are going to speak, who these people are. Are they the politicians or are they the ordinary people who are close to the heart of the times? So engenders public trust is the most effective when officials are attempting to galvanize the population to take positive action. Because what we need is positive action. What we need is that there is unison. There is like one common goal that is to get rid of infection and at the same time to start life going on again. So refrain from a harmful act. So that is our definition for student communication. And according to Klik 2007, Health and Human Services in 2005, and World Health Organization in 2020. Okay, so in 2020, strategic communication is indispensable. Indispensable for saving lives and for achieving an efficient mitigation process. So it is already there, and so we have to achieve some kind of mitigation process. And this is very important also, silence in crisis. Okay, silence in crisis as it magnifies the information vacuum. So silence, when there is silence in crisis, it magnifies communication vacuum. So information vacuum. So people start to think what's going on and they start to criticize negatively. So silence itself is communication, but it might be negative communication. Now, what is communicated here in Thailand? What are the things that communicated regarding COVID-19? So there's really massive communication since it started like first week of January. In fact, it started last week of December when it was announced in Wuhan, China. But massive communication started in January. We're going to look at that carefully in a short while. So we're going to look at general information, preventive measures, mitigating impacts, and then returning back to new normal and what are the innovations as well as online applications and framework of platforms, I should say, that were introduced. Again, the question is effective communication really helping? Yeah, so you can answer that in a short while. And we're going to look at that really, really carefully in a short while. So I'm showing you the news items or the news articles that are disseminated by the government. It's not by any other newspaper, but just by the government. I also collected another set of data, which is disseminated by newspapers of national circulation, and that data is also huge. If you're going to look at, for example, this COVID-19. So you can see here, I'm going to show you in a short while, really some kind of huge data that's being shared here. But we're not going to look at this data. We're going to look at the data that is being shared by the government. So if you're going to look at the word list here, we're talking about really huge data here. Okay, but as I said, we're going to look at this. If we have time, we're going to go to this part in a short while. But in the meantime, we go back to the PowerPoint. Okay, so I'm not sure if you can see the PowerPoint. Can you still see it?
Yeah, it's clear.
Okay, so I'm now going to continue. If you notice in January, so we heard already some news from Wuhan, China, that there is this ongoing infection. If you notice in January, you can only see this. There are only there are only like very, very few, okay, very, very few news articles that were really unique at the time. So I marked them, I separated them into two colors here. So you can have something like they're talking about Thailand on watch for pneumonia, so they don't know yet the name during that time. And then all of a sudden, in January, the 12th of January, they said the first case in Thailand happened. That was a female from a tourist from China, from Wuhan, China. And then on the 19th, it has been cured. So it went back. And then after that, on the 25th, we've got first person infected with coronavirus found in Thailand. The fifth person, I should say. So they were not really monitoring it day by day. It was like when they noticed that the infection worldwide is really gaining, that they started to take or to put more effort in monitoring it. However, if you notice, the public health ministry continues to scan people, as well as there are some efforts in trying to disinfect public conveyances, like for instance, the airport link and so on, where a lot of people are passing, and then they started strict screenings at the airports. So basically, what we are looking here is that they're trying all of these green news here, they're trying to give assurance that things are under control. So look at that. It says immigration checkpoints implement enhanced hygiene measures. This is giving assurance that they're doing something. Recommendation to reduce risk of coronavirus infection. Again, they're doing something. Thailand can still control the coronavirus. Again, it is an assurance. Okay, this is another province in the southern part of Thailand. This is one of the top destinations for tourists. And then this is the first province to set up response center. Again, this is an assurance that, hey, we are an international province, and yet we are receiving still people from other countries, and yet we are giving assurance that we are responding to this infection. And then provinces on high alert preventing coronavirus spread. So in January on the 29th of January, provinces here in Thailand already on red alert. Then the Prime Minister himself went to the top airport in Thailand to check, and they start to monitor devices such as masks in order to make sure that it is available for the locals. What is very, very crucial here is that on the 30th of January, the health minister proposes visa on arrival suspension for Chinese. So meaning to say, they cannot just come and then they ask for visa. It has been suspended. So this is a strong assurance for the locals that the infection can be controlled. Okay. So again, with that, all of those, aside from giving assurance, they also inform the people that you have to stay at home. They start to communicate, and we do our job. Okay, stay at home and let us do our job as frontliners. So that is always, this has been communicated since the beginning. Of course, there are a lot of people that are against this because they don't feel being impacted. During that time, there were like more than just 1,000, okay, several thousands of infection, and this was happening only in China, not all over the world. And it hasn't been announced as pandemic yet by the World Health Organization. Then comes February. So if you notice, last time we've got only this like 8 news. We've got only 8 news. In the private sector, private newspapers, there were more than that. But the government was trying to be very careful to give positive information as well as to give assurance. While at the same time, look at this red. They're trying to stay on guard. They're not complacent. Okay, they're not complacent. So in February, more. Okay, what we can see here in February is that the Thai government is showing fast action or fast help, like trying to contact the people in Wuhan, China, particularly the Thais, to bring them back home. Okay, you can see here the violet, the purple color. You can see here the Thais in Wuhan to be evacuated. Then 137. So this is like they have already started repatriating the people in Wuhan. So this is trying to show that there's fast action that's going on there. At the same time, if you see this one, this blue colored box here, TM concerned about people provide support to public health practitioners. So they understood that the frontliners are the health practitioners, and as shown by the news in China, a lot of these people, these practitioners are dying. So we heard about the ophthalmologist who found the virus, who was talking about the virus in China, died. And so they started to show empathy towards health practitioners or the frontliners. And there was also this blue here. If you notice soldiers here, they're trying to show the news, they're trying to show that they empathize with Thailand has close relations. So all of these, the green as well as the purple color, are trying to show the immediate actions that's being done here in Thailand. Also, they are trying to be transparent. Okay, so they know that the coronavirus infection is increasing. So the red color, they're showing transparency here. They're showing that we already have 25 confirmed coronavirus cases. So don't be complacent. Stay at home. So they're saying stay at home. BMA, Bangkok Metropolitan Authority, prepares coronavirus quarantine facility. As early as 7 February, they have started already quarantine facilities that are located in Bangkok, in provinces, and also at the border. Okay, because we have a lot of borders. Okay, and then in tourist spots in February, they haven't closed tourist spots yet. So we have here the floating market. So trying to send support to China, and they're still open. And at the same time, they're giving assurance that, hey, you can still buy masks, there are still sanitizers, the government and we are still ready and can face this problem. So the PM as well is giving moral support and so on and so forth. In terms of money, in terms of help towards those that are affected, we have what we call Chim Shop Thai. Chim is taste, shop is shopping, and then Chai is use. So this is like, it started in if I'm not mistaken, September last year, wherein the Thai government is trying to stimulate the economy by promoting local tourism. During this time, they don't allow tourists to come in, but they stimulate local tourism. So still in February, there's still tourists going on, but local tourism, and they're providing a lot of incentives so that people will use their money. At the same time, the government provides money. And then, okay, so 10th of February, you got here 32 cases from 25 on the 6th, so quite fast, okay? And then there are some requests to dock, D-O-C-K, to dock here in Thailand, because we got courts as well, but they were not allowed to dock because we had already to the grassroots with the public health volunteers. And these are funded by the private sector. So when COVID infection started, they tapped on the private sector, on these volunteers, and they are the ones that are close to the hearts of the locals. And these are the ones who worked with them, who followed, who traced, did the massive contact tracing. It's not the people from the top. It's in fact the locals. It's in fact the volunteers who were trained to do some kind of public health jobs, okay? And they were given the necessary masks, the necessary gloves, the necessary gadgets in order to combat, in order to fight infection and to inform the public. Okay, so if you notice in terms of transparency, they confirm that there are some medical staff. That is why the Prime Minister is out again to inform them that we need to really stay at home. But at the same time, look at the green here. There are so many greens here that everything is under control, and they're assuring that they're doing something not only at the airports but also at the borders, like this news. Okay, so and another thing is that they are showing that they are aware that there is like some kind of economic impact. So they have been looking at this as well. economists of the government started to create strategic plans in order to help those that are affected. Then, also still in February, you can see here that there are a lot of things happening in terms of empathy. But what is very, very important is here: ties, help ties, fights COVID crisis, revives economy. Again, there is a strong call to the elite as well as to the private sector to help, to do some kind of volunteerism and sharing. And this was very successful. And this has gained confidence from the locals, and they started participating. If you notice as well, recognition, there's also recognition here. FK gives volunteers medals for helping. So they were not just left behind. They are not just there. So they were invited and they were recognized. I don't know if there is monetarial awards. We don't know about that. If there is, it's good, but I think there is, but they were not disclosed.
Excuse me, Dr. Jonathan, could you please?
February, massive education and information dissemination that is being brought to the public. So like, for example, this one in the province of Kla, they educate the local tour operators. So because there are still tour operators. If you don't know yet, Thailand has more than 40 million, about 45 million tourists annually, and most of these are Chinese tourists. So there is like massive education not only for the locals, but as well as for those who are doing like whose jobs are involved with the tourists. So in February, there were like about 41 news for 1 month. Again, if you're going back, there is on empathy, transparency, assurance that everything is under control. They start to recognize, and they call it volunteerism, while at the same time, they educate people and they enforce the law. Okay, they enforce the law. So if you look at this, Public Health Minister confirms no call for enforcement of security law. And then there's another one here. The Deputy Prime Minister to implement measures to discourage COVID-19 super spreaders. So we've got this law to prevent super spreaders. Like, for example, if you don't disclose that you have been, like for instance, overseas, then you are penalized like 20,000 to 40,000 baht.
Oh, okay.
So all of these kinds of measures have been done in order to prevent super spreader, because sometimes they just go around and spread the virus. So again, the call, this is the very call of the government that we have to stay home. They don't say you stay home, they say let's stay home. Okay, so they encourage work from home and everything, including the government offices are doing like staying at home and working at home. So now we go to the month of March. Here in March, this is now.
Excuse me, Dr. Jonathan, can you show your slide presentation to March, because we are still in January 2020.
You cannot say it. You cannot. Oh, sorry.
Okay. So
oh, yeah, they should have been like.
Okay.
Can you see it now?
Still January. So maybe you can move on to
no, I
March.
It again. Now I'm already here.
Okay. So.
Can you see it?
Yeah. Now all right. So March.
Oh, okay.
2020.
So let me just continue. Let me
Yes.
just go back a bit. So I was talking about this.
Yes.
Okay, I was talking about it in February. Law enforcement. We're going to need my slides later. There are some analysis here already below here, very basic analysis that you can use, and you can even use this to compare it with your other news in your country and do some kind of research if you want to. The data is yours. You can have the data later if you want to.
Okay.
So there are 41 news in January, and now I'm here in March. So if you notice, again, there are so many green boxes, which are news that entails assurance, showing assurance. There's also on volunteerism. Okay, there's also on volunteerism, law enforcement. Okay, Commerce Ministry prosecutes vendors who grossly raise prices of face masks. Really, the penalty was really very high, that they are afraid to really raise the price of face masks. And then, of course, transparency, that health workers need face masks, and that Thailand is really didn't have enough supply during that time. But at the same time, there is a call from the government that they have to really listen to the government and they have to participate. And this is also the time where we started doing cloth mask workshops taking place across the country. And who is spearheading this? It is spearheaded by volunteers again. So they can prepare their own masks, they can prepare their own cleansing solution like alcohol and everything, and that is done nationwide. So if you noticed here, there are also like important things in every slide that you notice. There are some green boxes here, which means assurances. This is law enforcement. Because during that time, it was really very difficult for Thailand. We still have activists. We have a very new government in January. And then there is this like a lot of people, like particularly students, they want the government to step down. So they are having their rally, even in our university, we're having our rally. So activists are just investigation into face masks as well as their rallying. So it was really very scary during that time, but at least the government had done their part, and at least they were able to bring these people back home without having any bloodshed or anything. And then we've got here as well, there were like efforts to give reward for information of high-risk groups, as well as the Prime Minister's calling for government officials to be clear in what they want to happen. I think what's wrong all over the world is this. People, when the government speaks, the local government officials weren't able to understand what's really going on. What's really the government like to say. So they were the government saying this, but the locals, the local government units are doing another thing. So the Prime Minister would like to be clear. This is our plan. This is our strategic plan. We have to follow this plan together in order to be able to provide. So again, if you notice in the following slides, the most important here again is this slide on March the 10th. On March the 10th, the government canceled the Songkran Festival. Songkran Festival happens in April 11, 12, 13, 14, up to like 1 week. And as early as March, they canceled the event, and we are going to postpone it up to sometime. We don't know yet when. Because this is the time when people go back home. And when they go back home from Bangkok, they bring infection to those who are vulnerable in their residences, in the provinces, like for example, their grandparents and so on. So the government canceled it, and then there are all offices, government offices, there's no holiday. So it's a working day. It's very surprising. And a lot of people didn't like it, but it worked. It really worked. And it was very effective. This is another one in terms of law enforcement. Commerce Ministry prosecuting Lazada for allowing vendors to hike mask prices. It was prosecuted, and they have paid really a hefty fine. So it's again, other, what we call this, online sellers, so that the government really is going after these people who are taking advantage. So again, also assurance, do not panic buy. We have enough. The Commerce Ministry said. So during this time, if you go to shopping centers, you can see that the trolleys are not filled up to the brim. So they have just bought enough. They didn't we didn't see any problems like, oh, there are no more sardines, oh, there are no more beef. No, we didn't have problems like that. We had one problem, but it stayed only for like 1 week. We had problem about eggs. We ran out of eggs, but that's it. For 1 week, what the people did? They stopped buying eggs, and the eggs came out. The eggs came out automatically after 1 week. They stopped buying eggs because the prices of the eggs went like 10 times. The price is 10 times, like 300, 400 per tray. So the people said, we don't have to eat eggs, we eat other things. And then the eggs came out.
Oh, so it's like demand and supply.
Because they know that eggs are there. The commerce industry knew that there are still supplies. But, these other people just keep the supplies. Okay, so again, if you notice, there's also a large call in every month. Every now and then, they call for voluntarism or for this voluntary spirit, so that they join the government in the fight. And this is another one that the government did. Water, electricity bills down to help people during COVID-19 fight. So the government gave subsidy for electricity and water payment, water bills. Why is that? Because people are not going out. People aren't going to the shopping malls. Shopping malls are not closed, but they are not. They don't want them to go there. Okay, some parts are still open, like for groceries, but the government don't want them to go there. So if they stay at home, they turn on their conditioning. So what the government did was that there is subsidy up to bills down by 3%. In fact, it's more than that. There was like some kind of ceiling, like if there is like up to 100 kilowatt hour, this is the only amount that they're going to pay, and so on and so forth. And then from that time, there was also the introduction of innovation. Digital Ministry promotes work from home, like they try to tie up with Microsoft Teams, Zoom, Cisco, and so on, in order that they provide free. Another thing that they provided is that they tied up with the telephone companies in order to provide free data use. So like 10 gigabytes. And again, another one here, spirit of voluntarism, big cleaning activities against COVID. This is all over Thailand. So we also joined this. We cleaned our university and we disinfected everywhere. Again, there's a call for voluntary program here. And again, strong call to stay at home. But this is also, during this time, they also promoted other things. Like, for example, say, hey, you're at home. This is an opportunity for you, like the syringe face mask selling. So it sells really well because it's produced out of silk. So all of these, they were. It's not only like preventing or mitigating the impact of COVID, but it's also seeing opportunity out of these events. They were very, very transparent that in March 24th, they were saying that there are already 106 more cases and 3 deaths. So 3 deaths already. So they're already worried. So during this time, what has been announced was that we are going to have an emergency room. So during this day, it was announced that we are going to have emergency room starting the 27th of March. What is meant by emergency rule? Emergency rule means to say the government can impose restrictions. Okay, so the government can impose restrictions. So as you can see here, the cabinet agrees to invoke the emergency decree for 1 month, okay, for 1 month in order to combat. Also, if you notice this one, banks assures no account needed for assistance. So the government is paying like 5,000 per month for 3 months. For 3 months, the government will pay for those farmers, for those who don't have jobs, and for those whose income doesn't reach a certain limit. So they receive like 5,000 baht per month for 3 months. So March, April, May, and they're extending it up to June. Okay, so a lot of things going on at the same time here. And what is very, very important is the transparency. So after the invocation, after the call for emergency rule, they started having a designated spokesperson for the Thai people and another designated spokesperson for the international community. So they have 2. Only those two people will be speaking to disseminate information. Okay, so we've got here the Thai, and then there's another counterpart who speaks in English. Okay, so because we still have a lot of tourists here. You know what happened? Because these tourists are the sources of infection as well. The government said, okay, you don't have to come and renew your visa. Your visa is automatically renewed up to the end of June. You don't have to pay for your visa. It's automatically renewed. You don't have to come and report for your 90 days. So nothing about visa, everything is automatically renewed. These people, particularly the foreigners who are still really abundant in Thailand, stayed at home. You don't have to travel because traveling means the spread of infection. So really, it's a nice start for them. And as you notice here, we've got a lot of these donations. This is just one of the examples coming from the private sector. They start to to provide help to the government and to the local people. And then there are some checkpoints, as well as some of the provinces started to lock down. Bangkok is not locked down, but the provinces are locked down because we have borders. We are connected with Myanmar, we're connected with Laos, Cambodia, and then Malaysia. So we close the borders. No one is allowed to get out and get in. And then again, if you notice here, the frontliners, we are giving them recognitions. We're giving them recognitions. So from this time on, okay, so from here, we've got already 123 news. So that's basically more than four news items a day. These are only the ones that are monitored by the government. How about by the private sector? These things are not yet included. So again, the main message was that let's stay at home so that the government and the frontliners can do their job. So in April, this is almost close now, we have introduced the new normal. So during this time, from March to April, we are now under emergency rule. You know what is very, very funny, and people didn't really understand from the very beginning, was that during the emergency rule, there was this curfew. And the curfew was from 9 p.m. to 4 a.m. Oh, no, I'm sorry. It was from 10 p.m. to 4 a.m. at night. And then people are from everywhere were criticizing, both locals and international community. They were criticizing the government. Why are you closing at night? No one will travel at night. But they didn't understand at first what's really happening, what's really the mindset of the government. The mindset of the government is that when you don't close at night, people will go to the other provinces and travel at night. So that's what they are preventing. They don't want them to go out of Bangkok. During the day, they can easily be monitored because we have cameras. But at night, probably it's very difficult to monitor. That's number one. Number two, it is during this time that people start to drink. And then when they are already intoxicated, they ride their motorcycle and they have accident. When they have accident, they go to the emergency room. When they go to the emergency room, then we don't know already. From the time that they're drinking, they're not preventing. They have no mask and nothing. And then when they're drunk and they got accident, we don't know if they're infected. And so the frontliners become infected and treating these people. And also, that's the first one. The second one is that they pull the attention. The attention is shifted from taking care of COVID patients to those people who are getting sick because of accident, because of drinking, because of whatever, fighting, because after being intoxicated, they fight, they quarrel, and so on. So these things are prevented. And the frontliners had time to concentrate on treating the COVID patients, and they had time to relax at night. Okay, they had time to relax at night, so they are not really, really overworked. That is another thing that is crucial. Okay, so prices of commodities were controlled as well, but this is really very important. I don't know if this is true also in Indonesia, that because Thailand has a very good Red Cross society, they call on those who are infected, who have got better, cured of COVID infection to donate their blood. Thailand is one of the earliest who called on this, and we use the plasma in order to treat. I don't know if this is possible in a Muslim country. I don't know yet. Probably it is.
Mm-hmm.
So strict measures have been done, a lot of quarantine. So people who are coming back have been quarantined, and these are designated quarantine areas. And what is good is that they are tested when they arrive using RT-PCR. So it is confirmed right away, and then they are sent to different quarantine facilities after their arrival. But another crucial thing that Thailand has done in April is that it stopped. Okay, it added more requirements, even for Thais coming in. So before a Thai can come in, for international people, they cannot come in anymore. But for Thais coming in, like those coming from the Philippines, coming from the US, they have to provide a fit to fly certificate issued by a medical doctor, and then again a certification, another certification that they informed their embassies. So they have to inform their embassy, they have to be checked before coming in. So it's not really that like they allowed everyone to come in right away. This is to just give them enough time to prepare.
Mm-hmm. Mm-hmm.
Like prepare quarantine facilities and so on.
Okay.
So this was the one I was saying a while ago in April. There was this 10 gigabyte data from NBTC. And this has been provided because people start to work from home. When people start to work from home, sometimes the Wi-Fi connection is not enough, or they have to pay more. So it's given for free.
Okay.
And then they have to call on to donate blood as well, because they have to provide blood component products to those who are sick. And then we've got strong plans to decongest the hospitals. What is good here is that hospitals in the provinces are well equipped as well. So instead of, for example, sending one patient here of businesses, then they send it to other hospitals in order that this kind of hospital can concentrate on treating COVID patients. So again, transparency. So in every side, you notice that 45 new confirmed cases, whatever is happening there, they inform the public, and they inform the public at a very, regular basis. So it's every day from 11 o'clock to 11:30. That's the time they inform the public. If you go there, then you hear what they're saying, the plans, and what should be done, and what else can be done, and what should the local people be doing. Okay. So we mentioned already about this one.
Okay. So how is going on in May?
Yeah, we are about to go there.
Okay.
What is important here is that aside from the moral support that is given, there is also financial aid. So if you notice, as we go on, the assurances are still there, but they're more tangible help. Like aside from moral support, there is aid that's going on. You know, this is aid, this is financial aid, this is financial aid, and this is financial aid. Because the government know that people are not working for 1 month already, yes. And some of them are having this kind of lower pay scheme. So they're giving money, starting giving money, and strong call for strong participation, and even the members of the royal family have stepped in order to help. So again, look at that, private participation, strong moral support for the people, and then aid for tangible time of help. And then at the same time, they're saying that, hey, we are ready, we have now innovations here, we have now the negative pressure ward, and we're still giving recognition for those who are healthy. Mm-hmm. See, look at that, again, start of coming in, innovation, the help, the aid, and so on. And also you can see there, aid that's going on, and there's also aid and innovation again going on. So in the latter part of April and the beginning of May, the call is still there that they stay at home. But again, there are more things that are happening here. They're giving aid now, financial aid. At the same time, we started to feel the impact if you notice here, there are 3 more cases, only 3 cases on the 3rd of May. So it has already gone down. So people have been doing their part. They stayed at home. They reported some kind of infection. Even if they're not sure, they went. They have trusted the government. They have trusted the workers. And if they feel something, they report right away. So they call, and then ambulance comes in, and then they check. So the restriction easing, so they ease the restrictions. And still there is a call for private participation because they don't have jobs. Private entities should provide, at least if they can provide jobs, for instance. And we're doing now the new normal. Like, for example, in restaurants, we have divisions. In our offices, we have lines that at least 2 meters, and so on and so forth. And we, again, aid here, a lot of aids going on here, providing financial aid. And we're talking about new normal. Also aid, money, financial help, aid. And then we're talking about the new normal. Even here, we're talking about the new normal in hospitals. We're talking about new normal of social and physical distancing in public transport. New normal and strong public participation at the same time recognition. So you notice the shift coming from assurance. They're still assuring, but we are also showing, the government also showing that, hey, we cannot stay like this. We have to move on. And then we've got there, they are still talking about this, restriction easing, and then we've got recognition coming from the Prime Minister. This is very important because he's a strong Prime Minister and he doesn't bow to anyone. Now he thanked, because he called on the billionaires in Thailand to help. Now these billionaires help. So he's now giving really his sincere gratitude, which is really really widely accepted, and they love this thing. Then they've got new normal there, and the last one I'm going to share is the innovation on tanyaAmikom. I'm going to explain this in a short while, very, very briefly, but we have this innovation in order to check who is coming in and who is coming out. This is a kind of platform. So again, more on recognition there, and
Hello.
okay, so that's the end of the new. Now, if you notice here, it's not only for the locals. It says this is to help foreigners in Bangkok who may be affected by COVID-19 prevention control measures. So again, it is not only for the locals, but they understood that there are still a lot of international people in Bangkok. So they're not talking about third phase lockdown. We already almost have like 0 infection, but still the lockdown is on because we don't want the second phase to happen. And we have here the new normal. What are the things that could be done? Okay, these are the basic guidelines, and it is distributed in 3 languages, in English, in Thai, and in Chinese. Again, until here, the implicit message of the government is to stay at home, we stay at home together, stay at home, work from home, and we get rid of the infection. So from all of the things that I've mentioned a while ago, so who communicates? Who are the people communicating? So there are 4 here, the Prime Minister, together with the members of the Center for COVID-19 Situation Administration. These are the people who are communicating. There's a duly designated spokesperson for the local audience speaking in Thai language, and an duly designated international person speaking in English language, and also the government TV news anchors and newscasters who are designated, and they are against fake news. Whoever gives fake news or brings out fake news will be prosecuted. So they have a meeting every now and then. They are planning, okay, they assess, they design, and they decide on what to do, and this is on a regular basis. So we've got here the 2 persons who are designated. This is for Thai, and this is for in the international community. So they brief international and local updates in COVID. This is what they do every day. This is every day starting March 27th. So brief international and local updates, brief but concise reports on CSA activities, example, implementation of curfew, and so on and so forth. Brief reports on new innovations or findings, consistent encouragement, and call for audience to follow and obey laws. Okay, so for the mass media, they have 3. Okay, they are using 3. Number 1 is the Facebook, because they know that Thai people use Facebook. So they're using Facebook both in Thai and in English. And then they use also the website of the government and at the same time TV. So they have called it Move On. This TV, this is happening every night. Okay, every night, and they call it Move On. So three mass media choice. They use Facebook, the website, which is both in English and in Thai, and then the TV program. So the communication highlights what's going on. So this is overall what's happening. So this is January 2001. These are the things that they have done in the news reports. In January 2002, these are the things that they have done. In March 2020, these are the things that they are communicating in April and in May. So it's getting more intense. So what they have done in January, they have carried over here, but they have added more in order that they can go back to the new normal. So look at that in the last month. So this is this month. They start to allay fear because they're worried that there will be second wave. That they start to give advice because there are some mental issues now, and they introduce the new normal and they introduce innovations. So the type of information that are being disseminated are this one: assistance, assurance, general information, laws, participation by the private sector, innovations and opportunities, and returning to the new normal using the three media of choices: Facebook, website of the government, and the communicators are assigned or chosen. Again, with their implicit message, stay at home. Let's stay at home. So based on statistics as of the 21st of May, okay, so because this is the latest statistic I can get, but of course, as you can see, we have already almost flattened the curve. And now we have zero infection. The active case, zero new cases. The active cases now, I think we've got 48 or 49. So look at that. So the peak was during this time when the government started instituting the curfews and so on the 27th, and then after doing it for several days, for 2 weeks, it started to go down. So it was effective. They helped. In terms of death, okay, it went up to there, but as you notice here, from the start of the emergency rule still went up because of the infection, but on the third week it became a plateau. So it's now plateau there. Up to now, the number of deaths is like 1 or 0. This is good. And I'm also happy that Indonesia and the Philippines is quite high. So in terms of, according to the latest survey, Thais most likely to wear face mask in public and to use hand sanitizer. So Thailand, this is 95. Look at Indonesia, 87 is not bad. And then, but however, using hand sanitizer, probably Indonesians don't like to use hand sanitizer, but they wash their hand, which is even better. Yeah, which is even better than just using sanitizer. So what is really good about Thailand is that before COVID, Thailand has been acclaimed as number 6 already in terms of health security all over the world. So we are ready from the national government up to the local hospitals to the primary health care. We are very ready with that. This is our advantage. And from there, even we are extended up to June 30. We are not complacent. We are still doing our job. We're still staying at home. We're still wearing masks. We're still washing our hands very often. This is what I was trying to tell you a while ago. I'm almost done with my slides. This is almost done. We have this platform with the government. What is this platform? Is that for people to enter, because the shops are already open, grocery items are open, and then department stores are open. When you enter, you have either to write your name and your telephone number, or you have to scan. You have to scan in and then scan out. So when you scan in, so we know that there is physical distancing because we know the total number of people inside. So if the total number of people is like 500 is allowed. So if you're at 501, then they will not allow you to enter yet. You have to wait. So you can check in the application that, in this building, there are already like 500 people. I cannot get in yet. I have to stay in my car. So something like that. And then when people get out, they scan out again so that people will know when they can get in. So this is like one of the platforms that has been introduced, and so far it is working. Even in small shops, like for example 7-Eleven, they are introducing this. So scan in and scan out, so that at least contact tracing can be done. Okay, so they know because the telephone number is there. Okay, when you scan, the telephone number is registered, and so they know. What is good in Thailand is that all phone numbers are registered with the ID card. So if you use your telephone, it is connected with your ID card. So your ID card gives all details about you, your location, and so on. So it's easy to trace. So also, Thailand's introduced Thai prototype of COVID-19 vaccine to be tested this week. Okay, this week they are testing it on monkeys, and I hope that we are able to contain, that we will be able to contain, and we will be able to prevent the second wave. With that, I would like to say terima kasih, thank you very much, and I hope I have shared something useful for everyone.
So thank you very much for a very informative presentation, Dr. Jonathan. So we are happy to hear that.
That was like 1 hour and 15.
Okay, that's very informative anyway. So we already have like some questions from the participants. And first of all, I would like to say hello and then very welcome to some participants from Thailand, as well as I can see here, there are some from the Philippines. So we are very happy to meet you in our Zoom webinar. So can I start to raise the question for you, Dr. Jonathan?
Please,
maybe two questions, yeah? The question for the first batch. Okay. The first question is from Mia Widyaning Tias. The question is that, what is the role of influencer in providing public understanding? We understand that now there are so many influencers in YouTube or even Facebook and other social media. So any other influencer in Thailand as well?
Yes.
And
in Thailand,
yes.
the main influencers are public health officials.
Oh, okay.
They are, and also some media personalities are not really, but the main influencers are public health officials. So these public health officials, particularly those at grassroots levels, particularly the volunteers, they are the one that were able to reach the grassroots and influence the people at grassroots level to disclose of what happened to them, where they have been, and so on. This is very, very good because it can allow massive tracing and easier tracing of infection. I'll give you an example. Of course, there are some problems that when they realize that public health workers or frontliners starting to get sick, then they start to disclose. Even we also have influencers like these what they call these actors and actresses who got sick. They come out and then they disclose the information, like for example, where they have been, what they have done, and so on and so forth, so that these things inspired others also to come out and then disclose.
Okay, so the public health people who are in charge to communicate to the Thai people.
Yes, so they are to public health, and also these personalities who are popular, like actors and actresses.
Okay, that's very good. Okay, the second question is coming from Hutomo, students of the University of Amikom Purwokerto. He asked, what is the level of compliance of Thai people, with the rules that are applied during an emergency?
That is a very nice question.
Yeah.
Level of compliance is bad at first. So if you notice in the report that I showed you, we had like a curfew, but every night they catch like thousands of people who are violating. But what is good is that these violators are divided into two. If they notice that these violators haven't done anything bad in the past, and they're doing this for some reasons, and then they are just like given advice. But if they notice that they are frequent violators, then they are jailed and they are penalized, and the penalty is expensive. So the level of compliance from the very beginning was low, and it went up right away when they realized that people all over the world are dying.
So, okay.
Yeah.
All right. Thank you for the answer. Okay, so maybe you can stop your share screen, Jonathan. Could you
Which one? My?
Your share screen.
Oh, my screen. Okay,
yes.
sorry.
All right, no problem. There you are. Okay, that's lovely. We can see you now, your face. Okay, all right. So the third question is coming from here. Or maybe I can give you like an opportunity just for one or two participants to raise question directly. If the operator can unmute, so just one or two, so make this webinar live. Yes, please.
Oh, by the way, sorry, I'm not wearing mask because in this room I am alone.
Okay. Understand.
I am the only one using the room.
Okay, I'm here with. I'm here with some people, but we still have like a distance. Don't worry.
Distance.
Okay, thank you.
I saw Dr. Teresa Asistito wearing mask.
Oh, okay. Maybe she is with somebody else. All right. So, do you have any question from the participant? Maybe you can ask question to Dr. Jonathan directly. So, please, the operator can unmute so we can have direct questions.
Excuse me, please.
Okay. All right. Yes, please.
Okay. Thank you very much for this opportunity. Introduce myself, please. Can you hear my voice clearly, please?
I can hear some, but not really
okay. Wait, just try. Just try. If it is not working, so I can read the question again. All right. So, okay.
So it is not clear, my voice?
That's clear. That's clear. That's clear. That's
clear. Okay. Yeah. Okay. Mr. Jonathan, also from Universitas Amikom, thank you very much for this opportunity. My name is Cahya Fajar Budi Hartanto. Actually, I already write a question into the chat, but it is an opportunity to have a question directly to Mr. Jonathan.
Okay.
Nice to see you again, as we long time no see when I went to Huachiew Chalermprakiet to sign MOU with.
Oh, okay.
So, yeah, following with APTC at the time.
Okay.
My question is, how can we communicate effectively with the students, especially for the student who went to the vocational education? They choose to go to academic, polytechnic, to do more practical than theoretical. But now in this COVID-19 era, we cannot teach them practically. We only teach them by online system. So mostly we do only theoretically by maybe Zoom or Google Classroom, everything. But how can we encourage their spirit of learning by good communication strategy to make, because as we know, at the beginning they have very high spirit because they are learning the new way of learning by using online. But then the presence and their attendance become less and less and less because I don't know how to communicate it to them. I think that's my question. Thank you very much.
Okay, thank you. Yes.
Thank you very much, Mr. Cahya Fajar Budi Hartanto. So that is a very nice question, and it is a question not only for you but for everyone. I cannot answer it myself, but I'm going to share what we are doing here at Huachiew Chalermprakiet University. So, see, your vocational student is similar to our nurses, nursing students, and also to our pharmacy students, and also to our food technology students, and also to our artificial intelligence students, they need something. They need practice or practicum. And because of COVID, this practicum has stopped. And we cannot do anything because the parents don't want to send them to these places for practicum purposes. So what we are doing is like this. So, for example, for summer classes, we're still doing a lot of online activities. But for instance, we have 30 students, 30, okay, 30 students. What we do is that we divided the class into 3. In Thailand, we have 45 hours per semester. So we divided 45 into 3. So that means 15, 15, and 15. So 3 15s. So we have 3 students, 3 groups of students, I should say. So 15 hours is for 10 students to come to the university and study face to face for 15 hours only. And then they go back and join the online. So it is simultaneous, face to face, while there is a live class. Simultaneous. So the other 20 students are joining the live class, but at the same time it is recorded. So those who are there do the practicum in the class. We cannot send them out yet, so we try to stimulate in the university. Some things we can do it.
Yeah, I got it.
Properly, but some we cannot because we need other facilities from outside. But at least we're providing them something. And this is happening in a rotational basis. So after 15 hours, they stay at home, then the other 15 comes in. Evaluation is also done during that time. So when they participate, these people, these students, become the model. And because there are only 10, they can already maximize the use of all the facilities there. Not no longer 30, but 10. So that help more or less for them to really do it within the kind of 15 hours meeting. So that will be 5 weeks, okay, continuous. Because some people come from other countries, from other provinces, they stay with us in our dormitory for 5 weeks, and after that they go back home. So that is what we're doing right now. The new normal kind of culture. This is because we don't want them to crowd inside the classrooms and in our shops, in our workshops. I hope I gave you the answer. And because they are models, they know that they are not live, so they are happy to be live. People are watching them. So they're trying to wear their best. What do you call this? Be careful in what they're doing, whatever they're showing. Everything is recorded, and they know that there's recorded. So they read in advance. They do it correctly. I hope
Thank you, Dr. Jonathan, for very informative explanations of the question. So now I would like to have like one other question. So maybe you can have directly live. Any? So okay, we can unmute. Is there any?
Excuse me? Excuse me?
Yes.
Hi.
Hi. I have a question to Mr. Jonathan Rante Carreon.
Oh, all right.
Yes.
Hi.
Yes.
Can you mention your name, please?
Oh,
My name is...
very nice view.
Yeah, very nice to meet you too. I'm Lestari from Amikom Purwokerto University. I'm a student of Komunikasi Science.
Oh, okay. This is my
Yes.
students. Yes, Miss Umi, can you say something?
Yes, I have one question. In Thailand, is there any punishment for people who break the rules of regulation related to pandemic COVID-19?
There is.
Okay.
The punishment.
Yes.
Number 1,
punishment.
They pay money.
Yeah.
Number 2, they are jailed. Or both. Either or both. So the punishment, for example, for violators, like for example, during curfew is from 20,000 to 40,000 Thai baht. It is really big money. So they pay the money, or at the same time they're also jailed.
So
that's the penalty.
okay.
Okay.
So, thank you for questions, Umi, and also the answer from Dr.
You're welcome.
So I'm just wondering, Dr. Jonathan, is there any prisoners now who are already out of the prisons? Because in some countries, because of the COVID-19 pandemic, government are afraid of having them in the jail. So what they do is that they just release the prisoners. Is there any cases in Thailand?
No, not in Thailand.
Not in Thailand.
In Thailand, we have enough locations.
Oh, we have enough locations. So,
because when you say violator, they don't have to be in jail. They could be punished by being punished in quarantine facilities.
Okay.
So if they are in quarantine facilities, there are also guards outside. They cannot go out.
So,
but what is good in quarantine facilities is that everything is free.
Oh, okay. Okay, now I'm going to have to move on to another question. Or actually, we are running out of time, but maybe another 10 or 15 minutes, we still have time. Is that all right, Dr. Jonathan? Are you free? We still have plenty of questions, but I will give you like a...
Dr. Ade?
Yes?
There is one question here that is being asked by Yade. What type of technology is provided
you can.
in order to work from home?
Okay, you get
Is there
it?
any facility given by Thai government to private sectors?
You got the question. All right, so you can answer then.
So this technology, what the government has done is that it contacted these providers of technology like Zoom, Cisco, Microsoft Teams, so that they provide better terms. Like for example, for Zoom, if you are from an educational institution, it is not cut.
Oh.
There is like a link so that it's not cut every 40 or 45 minutes. For Cisco, it's already free. And they are also providing some kind of training.
Okay.
What is good is that, like what I said earlier, the government tied up with telephone companies in order to provide 10 gigabytes of free data. That is already good for working at home because they can use that for online meeting, for example.
Okay. All right. That's good. So are you saying that the government give this facility for free at the moment?
The Wi-Fi has been coordinated with telephone providers.
Okay.
So remember the Thai Prime Minister requested for help. And telephone company is private sector, and this is the response of the private sector.
Okay. All right.
Oh, there's another question here from
you can
from a good friend, Astrid Widiani of Surakarta.
Yes. Which one you get?
He said, "Hi, Dr. Jonathan, can you share best practice from your university during this pandemic when doing online learning?" In fact, I have mentioned this already. It's not just online learning. We are doing hybrid.
Okay.
Online learning doesn't work 100%. Because what happens if it is just online learning is that
the Bluetooth device is
I don't like to learn you anymore. It's not fun. I have to go. I will enroll to.
the Bluetooth device is connected successfully.
So what we do is that we provide hybrid. So we do online learning for around. In fact, the online learning is all throughout. But as I've said, we divide the students. So they come, other people come and join as models, while the rest are watching online. And then it's on a rotation basis, and then they come back, and then they also come when their time to come to the university. But during this time, aside from what they are doing, like the telecast, the discussion on Zoom. This model does everything like what's happening in a real classroom. So they feel it, and they have like 5 weeks to do this. The rest they join from their homes. So for us, this is more effective than just doing online learning. Because for online learning, once they turn off their video, you don't know what's going on anymore. So at least they have chance to come in the university and join us.
Okay. All right. So thank you for the answer. Another question, I mean, here, I can read here. Maybe I go back to the earlier chat. The question is that about your or your king, because you mentioned often about the prime minister. Is there any, like, does the presence of the king affect the citizen compliance to the government, and how much the king influence the government in making decisions regarding handling COVID-19? So,
in fact, the royal family is separate. They don't implicate the royal family in the political affairs.
Oh, okay.
So if they join.
Sorry for the connections. Hang on for a second. We try to connect it you clearly. But you can. Is that all right?
Is it okay?
Okay. Is that all right? Okay. Go ahead. It's already clear. I mean, we can hear you. Can you say something?
Yes. So as I said, it is a separate. The royal family is a separate entity. So they already have their own programs in order to help mitigate the impact. But this is independent of the government. This is independent. I mean, not 100% independent, but they're doing it separately.
Okay.
And so through these actions, because Thais revere the royal family really that much, so this inspires them to really follow what is being instructed or mandated by the government.
Okay.
There is one here asked by Risista.
Yeah. Can you read that one? Yeah. This from.
Based on your opinion, is there a new communication pattern that will build new social construction? Oh, this is this personality.
This personality.
Is there any communication pattern? Because see, I have to start from the very beginning, from the background. We just came from what we call this digital era or industrial revolution era. This industrial revolution era, coupled by this COVID-19 era, will really change communication patterns. So from face to face, communication, from face to face classroom encounters, there will be more, of course, there will be more online based, but I'm very, very sure it's not just online, it will be hybrid, which means that there is a transition from the traditional classroom settings, from the traditional communication settings, going through hybrid, which means it's a mixture of both, and then before going online. And probably in the future, there will be proliferation of more or a lot of online classes happening, and we should be ready for this, particularly educational institutions. I'm very, very sure that we cannot just shift and go back to the traditional, especially during this first 2 years, because we don't have the vaccine yet. Even if we have the vaccine already, it can be afforded only by the rich countries. I'm very, very sure it cannot be distributed freely to everyone. So there will be some kind of fear. And so most of the communication patterns will be online, and there will be hybrid in cases of urgent or any kind of communication that cannot be accomplished online.
Okay. Okay. Dr. Jonathan, can I connect the question to the earlier?
Yes, please.
Okay. Yeah. Is there any philosophy that drives Thai people to stay at home, stay positive, and the like? It should be like a sort of philosophy of things that because we can't say like, oh, you have to stay at home, stay safe, stay healthy, and the like. It should be something about them. Is there any?
When it comes to philosophy, I'm not really very sure about that, but they believe in what we call sufficiency economy philosophy by the former king.
Okay.
And when you say sufficiency economy, the more you go out, the more you spend money. Okay, when you go out, then the more you spend money. But when you stay at home, you prepare your food at home, you don't travel, then you're saving more, especially those who are working. They're receiving their money, who work from home, and still they receive their salary. So they don't spend extra. But what is really that is quite interesting is that these people, especially the Thai people, when you tell them that they stay at home, provided that you can communicate with them through online sources, like for example our classes. For the younger generation, they're okay. For the older generation who cannot cope up with this level, then probably it is problematic. But as I've said, when it comes to philosophy, when it comes to that higher thought, higher thinking, I think they are still using the sufficiency economy. That, hey, I can already communicate at this level. I can connect at this level. I don't have to travel. So I am trying to maximize the use of this gadget. At the same time, I'm lessening, I'm becoming self-sufficient, I'm becoming, I am using what is just enough for this particular situation.
That's good. That's good. We can learn from that, Dr. Jonathan. So I think because we are running out of the time, so I'm going to give you one more questions before we close this webinar. So this question coming from Dian Indriani. So we'd like to have like your suggestion to Indonesia about combating the COVID-19, because we understand that Thailand had strict and complex anticipations of COVID-19 since January. I understand that Thailand is the first country in Southeast Asia who confirmed, because I remember when I was still in the office, you said that, oh, I'm already in the quarantine, I can go anywhere. I still remember that.
Yes.
Yeah. So
yes.
Do you have any suggestion for all of us here, for the participants of the webinar? Yes, please.
In fact, what should be done is that you have to inform yourself. You have to, this is not the time to complain. This is not the time to push on what is happening in our daily lives. It is the time to really reflect and understand why is the government or the person in charge doing this for us. It doesn't hurt really much. It might hurt to some, especially those who are working like no work, no pay. But with the help that the government is providing, it doesn't hurt really that much. When you stay at home for a while and limit, for example, your activity. So it says here that any suggestion for combating COVID in Indonesia, I think it's a different case, very, very different case, because of the population of Indonesia and the archipelago that you have. as well as the practices that you have, and as well as the events that you are having during the COVID period. Like, for example, you have Ramadan, you have other things. You had Ramadan last time, and you cannot, for example, eat. If you're not eating, probably you are losing some kinds of nutrients and you're exposing yourself to some kind of lower immune capability. So that is also another kind of factor. And then you had also other events, like, for example, the end of Ramadan, wherein you've been doing this like annually. And so a lot of people, like, they are really difficult. It's really difficult to stop them. So from the very, very beginning, I think it would be nice to really engage at proper communication media and trust. If the people, the grassroots, really trust the government, really trust the people who are talking, by all means, they will follow. So they have to, that is what the Thai government has been doing, to create, to engender trust at the grassroots level, so that what is being mandated by the government is easily accepted. Also, of course, there are some other issues there and problems that those people who don't want to follow, but more or less the general public will follow it. So proper communication, the appropriate media to use, how to really reach them, listening to them, and then finally trust. They only listen to you when they trust you.
Yeah, that's very important thing.
Thank you.
Trust, because we cannot ask people to trust you.
Yeah. If they trust you,
you build your trust.
In some countries, if they trust the person, then they really listen.
Okay.
And it's easier to really to what they call this, to implement mandates and laws.
I agree. So, okay, it's nearly 11 o'clock my time here. I think the same as in Thailand, right, Dr. Jonathan? It's already nearly 2 hours. Oke, jadi Ibu Bapak sekalian, sebelum saya tutup, saya akan umumkan sedikit. Bagi Bapak Ibu yang sudah bergabung dalam acara webinar ini, nanti dapat bisa dipoto nanti linknya. Nanti sebutkan atau tuliskan nama lengkap yang ingin Ibu Bapak tulis di sertifikat. Kemudian nanti Ibu Bapak silahkan mengisi form evaluasi mengenai penyelenggaraan webinar ini. Sudah bisa kelihatan? Sudah kelihatan ya? Jadi ini alamatnya, nanti silahkan Anda foto, nanti klik link berikut, tulis nama lengkap Anda yang ingin Anda tulis di sertifikat, nanti kami akan mengirimkan email beserta slide presentation yang tadi Dr. Jonathan sampaikan. Ya, begitu saja dari kami. Alhamdulillah pada akhirnya kita sampai pada penghujung acara. So again, we finally come to the end of the presentation. So hope that our today webinar is very useful for all of us. Dan tentu saja kita selalu semangat, tidak pantang menyerah, drop slogan-slogan yang negatif, kita pantang menyerah. Kita akan selalu bisa mengatasi masalah COVID-19 ini. Insya Allah dalam waktu dekat kita akan menghadapi new normal dan kita bekerja sama dengan komunikasi yang lebih baik dan lebih efektif. Saya Ade Tuti Turistiati dari Prodi Ilmu Komunikasi Universitas Amikom Purwokerto menyampaikan terima kasih. So again, Dr. Jonathan, thank you very much for your very informative presentation, and also to the audience wherever you are. Thank you again for joining, and we hope we can see you again someday somewhere. So we are welcome here in Amikom Purwokerto University. Again, selamat siang, hari menjelang pagi menjelang siang. Stay happy, stay healthy, and be strong. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Bye.